Hello, I'm G.O.P. George. Welcome to Third Space Conversation. Today we have with us Dr. Kirk Strosahl. He's a leading innovator in the field of clinical psychology. In 2009, he received an award for his outstanding innovations in psychology from the American Psychiatric Association. He's the co-founder of Acceptance and Commitment Therapy and is also a pioneer in developing evidence-based models for assessing and treating suicidal behavior. His book, Clinical Manual for Assessment and Treatment of Suicidal Patients, published by American Psychiatric Publishing, is regarded as a classic in the field, and the models he developed are widely used by healthcare systems and therapists all across the world. Welcome, Dr. Strosahl. It's a great pleasure and privilege to have you with us today to discuss about suicidality and suicidal behavior. Thank you, Doctor. Without wasting any of our time, let's dive in right to the topic of our discussion today. The first question is, how will we make sense of suicidality or suicidal behavior? Why would anyone want to, why would anyone think about, doing that to himself or herself?
Well, at least in the Western world where we have more data, it looks as though suicidal behavior is pretty common. For example, the lifetime rate of suicide attempting in just the general population is somewhere around 10%.
Okay.
So if you just by way of comparison, that's greater than the number of people who will develop an addiction sometime in their life.
Okay.
So you have to look at when you have those kinds of numbers, you have to kind of shy away from thinking of suicide or suicidality as abnormal, and that it must be reflective of some kind of process that everybody is susceptible to. And that's, I think, a more fruitful way to think about this, that any person who's subjected to certain kinds of psychological conditions, psychological pain, emotional pain, is vulnerable to thinking about suicide as sort of one way out of the painful situation they're in.
So the person does, Just talk.
We talk about three specific features of emotional pain that make people desperate. One is they can't tolerate the pain. So we call it the little acronym we have is called the 3 I's. So in English, the pain is intolerable, the pain is inescapable, and the pain is interminable. So the intolerable means it's so intense that people just can't tolerate the amount of distress they're having. It's inescapable in that you can't stop it. Anytime you slow down and look and see how you're feeling this pain. And interminable basically means there's no prospect that it's going to end. You don't see an end to it. Pretty much across age groups and all the way down to, I would say, adolescence, all the way up to the advanced elderly. Kind of research has shown these are core features of suicidality.
Okay. So this has nothing to do directly with depression or any sort of mental disorders, because we had this incident that happened in our country, and and there was a discussion connecting depression to suicide, and that was going on. So does it have anything to do with disorders per se, or is it a very normal way of thinking through a problem? What would you say?
I tend to think of suicide as a response to feeling bad. So if you actually look at the rates of suicide in different diagnostic groups, the rate of suicide in anxiety disorders is just as high as the rate of suicide in depressive disorders. The highest rate of suicide proportionate to the number of diagnosed cases is actually in schizophrenia. So it's a bit of a mystery why the architects of the DSM system decided to sort of single out depression and to kind of claim that that is the root cause of suicidality. And there's also quite a few studies done over the years which show that people that have committed suicide, a fair percentage of them have no mental health diagnosis. When you go into their records after they've killed themselves, of course, those studies are horrible in terms of the bias they already carry.
Yeah.
You know, because people will tend to remember the social stereotype, well, he must have been depressed because he killed himself, as opposed to perspective, you know, looking forward studies. There isn't really any strong evidence that one type of mental health problem predicts suicide more than another type of mental health problem. So I think it's probably better to say, you know, just like in depression, some people have mild depression, some people have very intense depressions. The same with anxiety and panic, and the same with PTSD. You know, we're looking at a continuum of suffering, and the more intense people's suffering gets on whatever continuum they're on, the more they're going to run into those three I's, right? There's a point at which I can no longer tolerate how depressed I feel, or how anxious I am, or how intrusive my memories of abuse are, or whatever. And then I try to get rid of them, and they don't go away. And in fact, they seem to get worse when you start struggling with them to try to eliminate them. So now it's kind of feeling like they're never going to go away, because every time I try to make them go away, they actually get worse.
Yeah.
They don't make them go away, they're just still there. So
is it right to say that than depression or anxiety or any sort of disorders of that sort, experiential avoidance may be one of the causes, you know, one of the strong causes of suicidal behavior? Like, from, is there data for that, or can we assume that?
Yeah, I think, hey, the common pathway to suicide is what we would call experiential or emotional avoidance. So once you determine that you're not willing to feel what you feel, that you have to get away from it, you have to avoid it, run from it, you start a really destructive process in motion that will actually amplify your suffering. So the reason people get more and more acutely suicidal is because the harder they try to suppress the way they feel, the worse they feel. So then they start thinking that they're really out of control, that this sort of thing is the master of my soul and I'm the slave, and, you know, whatever. So it's, you know, suicide itself could be thought of as the ultimate emotional avoidance move. I mean, you're going to actually terminate your own life instead of feeling what you feel inside.
Okay. So if it is experiential avoidance, what are the red flags we have to look for, Doctor? Like, you know, mostly in the discussions which we were having, people were asking about, you know, asking to look at depression and, you know, the scores and the Beck inventories and things like that as a predictor of suicidality and suicide risk. But if it's experiential avoidance, do we have any other tools to assess the risk or something of that sort which we can use?
Well, I think there are ways to talk to people about what they're experiencing inside, you know, and what have they tried to up to now to deal with that, right? And usually what you'll hear is people will give you a whole range of avoidance behaviors. I don't let myself think about it. I just try to think positive thoughts. You know, I go out and I have several drinks. I consume some drugs. That helps me feel better. I go and eat a lot. You know, there's different things people are trying. And I think that's sort of the key, rather than what is the symptom you're having, because symptoms don't make people do anything. Symptoms are just part of being alive. You know, what we have to get beyond is counting people's symptoms, because there's lots of people who are depressed who don't do anything with suicidality, right? I mean, there's another process that's far more important. So I'll actually ask people, you know, what is it that you're feeling inside? that's so painful, so overwhelming that being dead would be better than having that.
mm, mm.
And is it possible that, suicide is kind of a way of um, controlling the pain,
Mm.
so that we change the discussion from "you must be depressed, let's see if we can help your depression"
Yeah.
to there's
What are you
something
doing?
that you're experiencing inside that is so overwhelming and so scary that it's in your mind it would be better off, you'd be better off dead
Mm.
than having to feel that or
Yeah.
have that in your experience.
Yeah. Well, that
And
makes so much sense, Doctor. Like, most of the cases, we were getting a few questions saying all the people in the recent cases we had in the media, most of the people said, the people who did an act of suicide, they were all fine before. So there was no active, depression or treatment or anything of that sort going. So this avoidance may be the key, right? So
yeah,
is there any sort of avoidance behaviors that are more a predictor of suicidal behavior than the other ones? Or is there something of that sort that you have came across?
well, in particular, fast acting avoidance behaviors in other sectors. So this would be drinking,
Okay.
using drugs, eating disorders. I mean, if you look at the co-relationship between suicide and other forms of fast acting emotion avoidance behaviors, there's always a significant overlap.
Mm-hmm.
So these are, in the English, we call these are all birds of a feather. They're parts of feathers of the same bird,
Yeah.
right? It just looks like they're different because of the form, but in fact, they have the same function. They're trying to, you're trying to get rid of the way you feel. You're trying
Yeah.
to numb yourself out.
Well, it's very interesting that none of the tools we have is actually looking at this fast avoidance methods and experiential avoidance to say that is there.
Yeah.
Doctor, like other any other other things, other myths or misconceptions about suicidality and suicidal behavior that we should be we should be looking into to understand this better. In your book, I was reading clinical lores versus clinical research, and that itself was a great title. It hooked me into it. And are there any lores which are not supported by research, which we should be really getting into an understanding to understand this phenomenon better?
Well, I think when it comes to like younger people, there's this fear that people have that talking about suicide with them
Hmm.
and asking them about it will actually put the idea in their head.
Okay. Yeah,
And
yeah.
that you're,
I'm a bit
at
scared
least,
of it. I work with teenagers, but then I am a little scared of directly talking with them. I used to think about whether it will put ideas. Yeah.
if you just come out of nowhere and ask somebody if they're thinking about suicide, that's different than when you're talking about being dumped by your girlfriend or, seeing people killed in your neighborhood,
Mm-hmm.
and discussing the painfulness of that, and then it's much easier and more natural to just say, sometimes when people get in a lot of pain,
Mm-hmm.
like you've been experiencing, they think about ending their lives. Has that gone on for you?
Mm-hmm.
And then it's a chance to normalize uh, that anybody, if they're put in these such circumstances where they don't know what to do with their pain, they're probably going to at least think about suicide for even briefly. And that doesn't mean they're going to do it. It just means that they may think about it. Right. So it's, I used to run into this all the time when we were doing research in schools, is the parents and the principals would say no because we don't want you putting ideas in our kids' head.
Yeah, I've heard a lot.
These kids already had these ideas. I mean, this isn't like you have these ideas locked in your barn in the backyard
Yeah.
and nobody's going to ever see it unless we let it out.
Yes.
Kids talk about this stuff all the time.
Yes, they do.
In
And it's
social
all over the
media.
media. Yeah, it's all over there.
Yeah. There's actually one social media site. It's not a website, but it's a place where this girl basically, the only thing she ever posts about is all the thoughts she has about dying
Oh.
and the things that she's done to hurt herself. And she's somewhat of a cult hero in, that generation, the 15 to 20-year-olds, because she's speaking for a lot of other people, that they feel alienated. They don't really know what their brains are not fully evolved yet. They're having their identities are still being formed. They're heading for some rough life experiences, even in normal times. So I think if you just say it's out there, people are talking about this, it's better to kind of walk into it with a casual, open posture, that this is something people think about.
Yeah.
And some people, they actually go ahead and they do it. So it's not taboo to talk about the fact that this is something you might be thinking of, and if you're thinking of it, I'm not going to freak out.
Yeah, it's perfectly natural. It's common.
Yeah, it's very common, and I didn't talk about the rate of suicide ideation. I talked about the rate of suicide attempting being 10%, but the rate of serious suicide ideation in Western studies over the lifetime is somewhere around 40%. These are people who think seriously about suicide, but never make an attempt, right? And then 10% on top of that make an attempt. But the death rate from suicide is only in the United States like 11 per 100,000. So, I mean, the ratio of people who die by suicide to people who attempt it to people who think about it is astronomically large. Right? So the most common thing that's going to happen, it isn't like you can say with absolute certainty somebody isn't going to die, but the most common thing that's going to happen is people are going to think about it seriously and then they're not going to do anything. And the next most common thing is people are going to think about it and then make an attempt, which is not fatal, right? And then the most rare event of all is a person who thinks about it, makes an attempt, and dies from the attempt. So you're almost like 99 to 1. So if you'd be better off just assuming when you're talking to somebody that they're going to end up being alive here. It's not about whether they end up dead or not. It's kind of that's not the point.
That's true.
The point is, can we find other ways to teach you how to tolerate the way you feel, how to do things that do not actually escalate your own sense of pain and desperation, and find a place where you can let even unpleasant things that you don't want, maybe, see them as just as important part of you as the things that you do want.
I understand.
Yeah.
So this is something that should happen when people are teenagers, right? That would be a good age for doing this sort of a dialogue with them. Do you think, Doctor? In schools and things. So we've been working with communities. So they were asking a question: what should we as communities and schools and movements and organizations do to help people at risk? And so this may be one of the best things they can do. Start talking about it and having a dialogue with children and teenagers.
Yeah, and don't make it into a form of pathology.
Let's not pathologize it. Like let's consider it in a functional angle, and let's look at the function of it and talk about the function and do some intervention based on the function. Are you saying that, Doctor?
Yeah, I think I think if communities stop over focusing on just deaths by suicide, which are the rarest, and in all the research that I'm aware of, we've never really established that we have the technology via therapy or medications to prevent suicides. and part of that is, there's such rare events, it's virtually impossible to predict ahead of time. You have all these people that look exactly the same at the start of the process, and out of that cohort of people who go there and think about suicide, you're going to have 4,000 people ideating, thinking about suicide for every one fatality. So the odds are just overwhelming about being able to predict who's going to do it anyway. And then there are no real indications that, being in therapy per se reduces the risk of suicide. There's therapy that reduces the risk of suicide attempting and maybe ideating, but there is no therapy or medication I'm aware of for the average Joe out there that is certain to prevent a suicide.
Do we have any studies about ACT being effective because it's directly dealing with experiential avoidance? Do you think that will be, do we have any research on that?
Well, I think the evidence for ACT is pretty much going to be the same as the evidence for other effective treatments, if you can call them that, and that is it will help with the rates of suicide attempting and ideation. It may help people resolve things quicker and move on. I don't think we're going to see, again, it's just impossible to actually measure it, because if you just think about it, you'd need, I don't know, studies populations in the 1 to 2,000s, and there just isn't. That's just never going to be done research wise.
Yes.
Oh,
there will be a lot of chaos in such a correlation. If you're even,
I just sort of think it's better to, if you have an initiative in your community and schools, it's not about preventing suicides. It's about helping people who are suffering engage in behaviors that have a chance of working. Right? And that itself is a worthy goal. I mean, and so, what would you tell people? Well, one is don't hide out with your suicidality. But if people are going to hide out with it, if they feel like they're going to be stigmatized or labeled, if they tell anybody, right? So there has to be kind of a attitude that it's very unfortunate that people suffer. I mean, I think we could all agree. There doesn't seem to be much we can do about the fact that people suffer. What we can do is reach out in a compassionate, engaged, curious way that tells people that you are suffering and other people are suffering too. I mean, but it isn't like, why are you suffering? Other people are suffering worse than you. It's like, yeah, you're suffering. You're part of, the stream of life, and in the stream of life that people are traveling down, things happen. And, so suffering is sort of a rite of passage, and what does suffering teach us? It teaches us how not to hate ourselves, how not to blame ourselves, how to be soft with our pain, how to be able to look beyond the moment and sort of think about, life as an unfolding process. And so the way I'm feeling now is probably going to change, and that this links me to other people. Having this pain teaches me what it's like to be in pain, and so I can empathize with what other people are feeling when they go through this kind of stuff. So in a lot of ways, pain makes you better if you learn how to not run from it.
Yes.
We all run. I mean, it's built into our nervous system to kind of avoid things that do not feel good, things that look threatening to us. So it's not like people should be blamed for running. It's more like, of course, you want to run away from this. I want to run away from this. I mean, that no one likes, to just let pain wash over them. That's not the question. The question is what you're trying to do actually helping, or is it actually making your pain worse? You know, and in most cases, it's going to be making my pain worse. It's making me feel more cut off. I'm less willing to talk to people. I'm isolating myself in my bedroom. You know, I'm feeling more and more abnormal. I'm having more thoughts that other people have a good life and I don't. These are all the natural results of sort of turning away from painful feelings.
So all the self-destructive, behaviors, self-harm, suicidality, everything has the same cause, right? And everything is kind of a similar response, would you say?
That's why they tend to co-occur. That's why 50% of suicide attempts in the United States, people are intoxicated when their blood is assayed, when they're admitted to the ER. So it's there's a very high co-occurrence rate between bulimia, for example, pathological gambling, internet addiction, all these things people do to help themselves feel better. They're all correlated very strongly with suicidality. So I just see suicidality as sort of the last tool in that shelf, the shelf of avoidance. It's the most extreme. It's the quickest acting. It isn't the only response, but if you are dead set on avoiding what you're feeling, you're going to end up looking at that option if you keep doing it over time. It's just inevitable. And that's why I think the percentages are so high when you look at the lifetime prevalence of suicide ideation. That's because everybody avoids stuff.
In different ways.
Different ways. And you're eventually going to get in a situation in life where the pain is so intense, and when you avoid that pain, it actually gets more intense and you can't seem to get away from it. It's with you morning, noon, and night. And it doesn't look like it's ever going to stop. And, that you're going to think about killing yourself.
That's it.
Because it's just the natural next step.
When this is the natural next step, and when it makes a lot of sense, how will we address this issue? As in, if a person comes to us and, if he's seriously contemplating suicide, what should we talk about, or where should we focus on? What would you do?
I have 3 basic steps when I teach community, just have community workshops. Like some people in the audience are therapists, but there's a lot of parents, teachers, policemen, just a range of people, priests. So I just say there's 3 simple, immediate steps you can do inside this conversation. It doesn't take a lot of practice, but you should kind of have it down in your own mind so that when you get into the anxiety of the moment, you aren't trying to remember what were those 3 steps again. It's sort of, I know what they are. So the first step is you have to validate the person's emotional pain and sense of validation. So validating basically means, I can tell from the way you look and what you're saying right now that you are in a ton of pain, and I know that this is making you almost crawl out of your skin. So I think, I want you to know that I know that. So you can see if somebody is scared to death and they think their idea, the goal is prevent something bad happening here right now, then this is going to be really hard, because you could sort of say, well, if I tell them I understand that they're in pain, and maybe if I was facing the same thing you were facing, I'd be kind of where you are right now. I mean, I'm almost telling them to go kill themselves. I mean, you could see that. You have to kind of be able to say that's not going to happen. And if it is going to happen, there's nothing you're going to do about it with your interaction today, right? So the humane thing to do is you validate the pain first, and often you keep coming back to the fact that you understand that this person is in pain, because the biggest single thing we saw in our research studies on what turns off a suicidal patient, somebody who's coming in for help, who's actually broaching the subject, is when they don't think you understand how bad they hurt inside.
Yeah.
So once somebody understands and then understands again and again that you understand how bad they hurt inside, how desperate they feel, how at a loss they feel for what to do, they will begin to relax and listen. So that's step number one.
Validating
And
the pain.
when you want to rescue people, the first thing people typically skip over is they try to move right to solutions.
Yes.
And what a
And I
person
think,
who's thinking
there is another thing that when most of the people approach it from a higher moral standard or start discussing about right and wrong.
Yeah.
That's also something else. So validating the pain is the first step.
And I would say part of that validating is there is no moralizing. There is no saying, well, you shouldn't do that. I mean, you just don't do it. You don't say that.
Yeah, understand.
Because all that person will think is you're not really listening.
Exactly.
You're judging.
Yes.
Right? So non-judgmental acceptance, validation, and just taking your time and trying to get connected with the person who's in front of you, who's suffering. You could be a parent, a teacher. It doesn't really matter. I mean, this is going to be a human to human interaction. So you don't let your own sense of alarm and urgency and anxiety make you start jumping steps, right? Just take your time. I have diffused many suicidal crises simply by doing nothing but validating the person's emotional pain, letting them know that they're not alone, that there are people that understand, there are people that care, and I've never passed a single judgment, during the entire conversation, and they're looking better just from that. Because in that place of suicidality, you feel cut off from people, you feel alone, and you're scared.
Yes.
Right? So if you have somebody in front of you who's joining you, who's not scared, who's feeling casual, is able to be straightforward and use words and, not hide out, that's going to have a tremendous impact just on the psychology of being in a suicidal crisis. The second step is what we call the problem-solving reframe. And basically, I modeled that a couple times before already in this conversation, and that is, so it sounds like, you have this pain, X, that we've talked about, and it's so overwhelming and so intense that you don't know what else to do about it. And so is it possible that you're thinking about suicide as a way to kind of control or get rid of that pain? So this is the way to solve the problem of feeling so bad inside is to actually end your life. Is that, you think that might be going on here? That is the turnkey after validation, which is, instead of just talking about, are you going to kill yourself or aren't you, or aren't you, what weapons do you have, blah, 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 which is just going to fuel the person's anxiety and fearfulness, because now they're hearing that you don't trust what they're going to do. Right? Here's the alternative place to go, and that is, we've talked about the pain you're in. I've told you I think I understand. I've repeated that several times. And I'm just wondering, kind of how thinking about killing yourself fits in here, right? Do you think that this may be a way of solving the problem of feeling the way you feel? And if you can get people to acknowledge that, you now have taken suicide, which is basically kind of a fuzzy, scary, stigmatized phenomenon that people don't want to talk about. We've moved it into the light of day. Well, it's a way of solving the problem of feeling bad. And it opens a lot of doors in the conversation, which is, so what are some of the other ways you've tried to deal with feeling bad? Right? I mean, it gives you, plus no longer talking about suicide, the creature, the feared thing. We're talking about the function that the person's engaging in. And so we're no longer actually talking about suicide. We're talking about how you solve the problem of feeling bad inside. That's the problem, right? So one way to solve that, your mind gives you what you've learned, is you simply try to avoid it and eliminate it, suppress it. And so it sounds like you've been trying to do that in various ways, and it's just making things worse. Maybe there's an alternative. Right? Instead of trying to suppress it, push it away, eliminate it, maybe we should just lean into it and let it be there, and not go insane trying to keep it from being there, because it's going to be there. It sounds like your experience is this thing is going to be there even if you don't want it to be there. Yes. Right? So if you spend all your energy in that fight, then I can imagine you'd feel very, very desperate at the end of that fight. And, that's what we're talking about right now. This sense of desperation, the sense that you can't get away from this. And so maybe fighting, running, hiding isn't ever going to work, and even killing yourself isn't really, we don't know if it works either. We just know you're dead. We don't know how it feels when you're dead.
What happens after?
So, it's just a logical extension of running from what your own experience, right? And if you keep insisting on running, you're going to end up having to do more and more extreme things, because running doesn't work. It actually makes those experiences that you're running from more and more invasive and aversive and traumatic, right? So maybe the alternative is to turn around and just allow the pain to be there. Have you ever considered that idea? You don't even have to get to that. I think actually the simple fact that we've changed the conversation from are you or aren't you going to kill yourself to let's talk about how you solve the problem of feeling bad inside, right? That changes the whole feeling around suicidality. It kind of brings it down onto the ground, and you'll actually see people their eyes kind of light up a little bit. Like, I hadn't really thought about it that way, because most of what I've learned about suicide is it's a dark, scary, forbidden topic, and it just happens only to the sickest people, and it means you're mentally ill, and all these toxic mythologies that make people think that this is something out of the ordinary human experience. And when we draw it back into the realm of ordinary human experience, the fear factor that people have, the people that are thinking about suicide are scared. That's their predominant emotional experience, because they don't know if they can control what they're going to do, right? So when you get in that kind of mental place, it's a scary place. It's not necessarily marked by sadness or anything like that. It's more like I don't, the world seems to be kind of cornering me here. My view of the world is getting narrower and narrower and narrower, and it's leading to this place that's very scary, right? And at some point, people say something to somebody else. So we want to create a frame. We want to create a way of thinking about suicide that is not scary. And the best way to do that is it's just a problem-solving behavior. It's just like going out and drinking, smoking pot, doing opium, whatever. It's just a way to manage how you feel.
In this stage, I was listening to one of your interviews in YouTube, and you said about the use of humor. Is it something that, a little bit of a dark humor or something that's to get into the different perspective? Is it something that you use a lot? Or...
Well, I think if you can get relaxed yourself, if you're the parent, if you're the teacher, you're a peer of somebody, if you can relax yourself into the conversation, that is going to do a lot to reassure the person you're talking to who's been thinking about killing themselves or maybe even just made a suicide attempt. Because they're looking for cues on what to make of this suicide thing. Because as I said, the only thing that we ever really get in our social training is this dark, forbidding image of suicidal behaviors, right? And so if we're going to talk about that's not really true, people aren't crazy because they think about suicide. It isn't just mental disorders. There's lots and lots of people who think about suicide just because of overwhelming life stress. There are lots of conditions in life besides having some kind of mental health issue that can make you think about suicide. So for me, and this is sort of me, humor is one way to kind of lighten the atmosphere in the conversation. So I just did something I commonly do with people, and it's not flippant. It's not, I'm being condescending, but I'll say things like, we don't really know what it's like to be dead. There's people in psychology who've specialized in, studying what it's like to be dead. They send these questionnaires out to dead people, and the return rate is 0.
Yeah.
So we don't know. Right? So there's a little humor there, but actually it's also creating a little message, which is you don't know. I mean, you thought you would feel better when you drank a lot of alcohol, and look how that went. Look how that worked out, right? So in the back of somebody's mind, if you don't know what it's like to be dead, you can't be sure that will work either.
Yeah.
Right? Except the problem is that with that one, you're dead, right? At least with alcohol, you can go into rehab, you can stop using heroin. I mean, you're around to fight another day with these other avoidance behaviors, but this is the big daddy of them all, if you succeed, right? So it has this unfortunate side effect, and that is you have to be dead to try the solution.
Yeah.
And there's ways you can bring this in a humorous way, not lecturing, not sort of arguing with the person, but just it's a humorous thing. It's one of those, and I'll often say, why is it, and, being in a largely Judeo-Christian world over here, I'll kind of be musing with people, why is it that everything that makes you feel good immediately, what is it about God that all the things that work to make you feel good really fast are all toxic for you? What kind of conspiracy is that? Isn't that just like blah, blah, blah?
Yeah.
So just, kind of railing the spiritual universe, why don't you give us one thing that makes us feel better right now that doesn't kill us,
Yes.
please? Well, people can laugh about that.
Yes.
It's a silly thing, but it's actually not silly. I mean, humor, the thing about humor is that it ties into something that's real.
Yeah.
You're looking for something that makes you feel better really quick, and you just haven't been able to find it.
That's
right? And because everything like that is actually harmful to you, and so what is life trying to tell you?
Well,
So
the third
that
step.
was step 2,
Yeah.
right?
Yeah. Yes.
Step 3 is develop a positive action plan. So essentially, there's all kinds of variability in how serious people's suicidal thinking and behaving is. So there isn't any hard and fast rule. But I generally want the conversation not to jump over how you're feeling or to sort of say, we're not going to do suicide. In fact, I'll often say, I'm not going to keep you from killing yourself if that's where you end up being, because there isn't anything I could do anyway. Right. But I think it's sort of reassuring people that my agenda here is not to secretly get you to not kill yourself. Right. My agenda here is I want to help you deal with how you're feeling in a more effective way. And I want to help you discover that you have the capacity to do that, that you have people that care about you, you're not alone, you're not on an island, and that you have support, that nobody is tearing their hair out because you're suicidal here. We're not afraid. We understand, you understand, I understand that this is kind of what happens. And it's pretty natural. So there's nothing that we have to be concerned about. Let's just move forward in the conversation to, what do you want the person to do after they leave the conversation with you, right? So the old adage in Western psychiatry was, you try to get a no suicide contract. You try to people to promise they're not going to harm themselves, blah blah blah. There's almost no evidence that those strategies actually have any impact on the likelihood that somebody's going to do something self-destructive. And it's just basically, anytime you tell people to stop something, anytime in this conversation you start telling a suicidal person, a friend, a child, that you can't do that, you need to stop that, you immediately stigmatize it. You immediately give it negative energy. It isn't, I want you to start something positive, I want you to stop something negative, right? And when you tell people to stop something negative, it's because you're coming from a position of your own fear and anxiety about what's going to happen. That's all it is. It's just like telling a kid in your household to stop yelling, because the yelling makes you uncomfortable because it's so loud, right? So telling people to stop things is a very, very poor way to achieve some type of positive outcome.
Yeah.
So I want to talk about, what do you want somebody to start after the conversation ends today? And that might be things that give you solace, things that make you feel like you're connected to people. Is there somebody else you want to talk to about this? How do you want to organize your time for the rest of today, right? To start to get people thinking about something other than their own unmanageable feeling state, to begin to turn their attention away from that and toward behaviors that would tell you that you were starting to engage in positive, life affirming behaviors. I don't have to tell you not to kill yourself. if you're going out and joining a bunch of friends and taking a walk on the beach. I mean, that's exactly the opposite of killing yourself.
Yeah.
Except the whole conversation is positive. It's around life-sustaining things, soul-sustaining things that you could do. And I try to get really specific with people. And, you know, the more serious the situation, right? We call it the positive action plan, positive action planning. It's sort of a kind of behavioral activation. So we're putting people into contact with positive reinforcers in their world, because when you get into a suicidal tailspin, generally what you do is you withdraw from all from making contact with these positive reinforcers. So people who are friends who might be able to lift your mood, you start hiding out in your bedroom.
Yeah.
You know, if you were exercising and you like bike riding or surfing, your surfboard, your bike in the garage, and you just sit there and veg out and watch TV, right? So in a way, positive behavior action planning is behavior activation theory driven, that people's mood will respond based upon the kind of reinforcements they come in contact with. So if you're basically withdrawing yourself from all your positive reinforcers, the positive things in life, then your mood is going to reflect that loss of contact. So your mood is going to go down. It's going to be more and more apathetic, you know, numbed out, not interested in anything. Your mood basically follows your behavior. So this is another mythology I think that people have to understand when they deal with suicidality, and that is the behavior of the individual is driving the suicidality, right? It's not just emotional avoidance, but it's also behavioral avoidance. It's withdrawal, passivity, isolation. Those kinds of things drive negative mood states. They drive depression or sadness or anxiety.
So what we are doing in this action planning is like we are reconnecting them with what they enjoyed and what they treasured and all those type of. Am I getting it correct?
Yeah, in a very short term framework. So if you were really concerned about somebody like your child, it would be, what are we going to do between today at this time and then tomorrow at this time when I want to let's hook up again. See how things are going. So it could be a 24-hour plan. Somebody who's maybe a little bit more responsive, you know, just seems to be doing a lot better with the just empathizing, not feeling cut off, kind of understands that suicide is kind of a problem-solving behavior. They get it. Well, maybe that person, you might want to say, let's check in again in a week. But you know, between now and then, let's think about something that you could do each day, or on most of the days. If you did it, it would kind of give you a little positive boost. You know, it would give you a little emotional boost.
So when I told that, you know, I was preparing for this session with you, a brother actually, I mean, a person who has a brother who was actively suicidal, he has attempted like, you know, 3 times to kill himself. So he was asking, you know, how can he deal with his brother and make sure that he is safe, because, you know, his brother is staying home, you know, always all the time, and this person has to work and take ahead of his life, but, you know, he's always worried about the safety of his brother. So is this something that he can do? What will be?
Well, I think the 3 things that we just talked about, you just keep bringing them up over and over again. And I think eventually, in the context of that conversation with his brother, I would sort of expand the problem-solving thing. So, you know, how do you feel like it's working to stay home all the time in terms of your suicidality, how you're feeling inside? Do you feel like that's strategy? I know it's tempting to do it, and that your mind might tell you that there's no point in going out. But when you kind of do that, how does it make you feel? Does it make you feel better, or does it make you feel worse?
Mm.
Because I think just from that brief description you gave me, the brother is basically engaged in this sort of negative mood generating strategies,
Yes,
right?
yes,
Staying home, avoiding things, not contacting people. That is guaranteed to generate negative mood. So I would have to say the emphasis, you can't just go in and say, you've got to get out of the house. I mean,
yeah,
I'm sure he's already probably told him that.
yeah,
But I think having his brother discover in these conversations that, yeah, I sort of think I'm going to feel better if I just stay home and watch TV and I don't have to deal with people. But actually, when you ask the question, do I feel better?
Mhm.
After I've done that, no, I don't. I feel worse, right? And so
It's something.
that kind of recognition is what is often needed for somebody to say, maybe I should try something different, right? I mean, really all we're trying to do is maybe we should try something different.
Mhm.
Because this has been going on for months and months, and it doesn't look like you're feeling any better.
Yeah,
You seem really miserable, and I understand how bad this space can get. So I'm validating it. I'm not blaming you for doing the things that make you feel miserable. It's simply,
trying to help.
life is
Yeah, yeah,
life is full of traps, right? And
yeah,
one of these traps is when you feel bad, you don't want to continue doing things that feel good. It's just natural.
yeah.
But so you begin to add on to the downward spiral, because you're just doing the natural thing. It seems, oh, I'll feel better if I don't go and do this. I'll save my energy. I'll feel better tomorrow. But tomorrow never comes.
Mhm.
Instead of it preserving your energy, it saps your energy because you're not restoring your soul. You're not kind of generating juice for your battery, so to speak, right? You have to generate positive emotions by your behavior. They don't just come along
Yeah.
accidentally and randomly,
Mhm.
right? So you
Comes.
can put yourself in a place, if you try hard enough, you can put yourself in a place where there's no positive emotion potential, zero. And if you're in that space for very long, we're back into the three I's again, right?
Yeah,
Because that feels terrible. The very things you're doing to kind of address it are actually making it happen. And therefore, when you look down the pike, when you look down the avenue of life, you don't see this ever ending. I mean, if I keep doing this, I'm going to just, because you're actually not going to change it.
yeah,
Right? It is going to go on for as long as his brother does what he's doing. So I usually tell people, doesn't matter if you're a therapist or teacher, parent, you have to get people to engage in new behaviors. That's the number one goal in all of therapy. It's the number one goal in helping people who are suffering, because their suffering is being self-generated by recurring avoidance strategies. And so we have to break out of that cycle and get somebody to try a different behavior. That's all. And I almost don't care what the behavior is, to be honest with you. The fact is that behavior is going to interrupt these older behaviors that we know don't work.
yeah.
They lock you in on in a prison, right? So the only way you're going to get out is you have to go out and experiment with something that you haven't tried before yet.
So I think I have overrun the time that you have given me. But then, if I can ask one more question, would it be okay?
Yeah, sure.
Like
I'm not impressed.
when we are in this lockdown situation, most of the people are compelled by the authorities to be locked inside their houses, and this is creating a totally different type of mental health situation. So, what do you think are the positive moves that we can do? This enhancing moves that we can do while we are locked down. So, what would you say a person who is locked down inside a house in a place that is affected, and where there are very less chances of going out of his house. How can he deal with this, and how can he move a little bit towards this, getting pumped, getting fueled up situation stage?
Well, if you go back to what we were just talking about, this is a random act of fate, if you want to put it this way, the pandemic, putting darn near everybody in many countries of the world in exactly the situation I just described, which is your normal outlets, your normal sources of positive reinforcement are outside your house.
Yeah.
They're social in areas where you are not allowed to be social. And so the challenge is, can you invent behaviors that you can engage in inside the house that are positive and rewarding behaviors for you, right? It's a simple, and I don't think just doing more of the one or two things that you found rewarding in the house is going to work. I think you have to invent new things. So I've been, at least in the United States, people are viewing this whole thing as a huge stressor, right?
Yeah.
Kids are not going to school, so they're at home. Mom and dad are not working, or they're working from home, and so everybody is around everybody. And I find it ironic that that's what people complain about. I mean, in some ways, isn't that a dream come true?
Yeah, it is.
As parents, you actually are going to get to know your children because you're not dispersed out so widely that you never see each other, or you only see each other at specific times. Is there something inside of this being compressed together as a family that could become a source of joy, right? As opposed to something you're just trying to not go crazy, you're not trying to snap, right? Because I think that reflects that reflects a mentality about what your family is that has been shaped by this sort of more and more driven lifestyle that everybody is adopting. That family are creatures of convenience. You have specific moments in time that you read to your kids, and that's it. And when that gets disrupted and you're locked in, right, and you don't have your normal range of reinforcers and escape behaviors, maybe you could see this as a once in a lifetime opportunity to look in your kids' eyes, to learn how to play with your kids and be present instead of thinking about something else. I mean, to share a spiritual practice with your kids, to talk about your family legacy with your kids. I mean,
something. Yeah.
I don't know. It just seems to me. And then there are things that you can do with your kids, arts and crafts, and things that you could discover that might actually be kind of fun, and everybody's kind of enjoying themselves at home. It looks very much to me like in America, people are just, I don't know, we have lots of deer in America, animals that they run across the road and they see a headlight in a car coming at it and they just freeze, and that's how they get hit. What I see is people kind of looking like they're deer in headlights. That it's never dawned on me that I could actually develop a new way of relating to my core family members.
Yeah.
This is not an opportunity. This is a crisis. This is a stressor. I can't wait to get out of my house so I can go back to my sort of disconnected way of living, right? I don't know.
Yeah. Like I was at home for 50 days, and my mother was saying, this is the only opportunity we'll get in our lifetime to stay together. All my siblings were there, my father and mother were there. we got to spend 50 days here. So maybe we have to look into the opportunities that this lockdown is giving us, right? And rather than the things that are being restricted.
Yeah.
Yes.
You know, it's American saying, the glass is half empty or the glass is half full, right?
Mm.
So
Yeah.
I'm not trying to be Pollyannish. This will push you beyond what you might feel comfortable. It's going to push you into a zone that does not feel comfortable, because we develop our comfort zones,
Mm.
you know, and we protect them.
Yeah.
And we do that interpersonally, we do that with family, we do that with our household routines. And when we get pushed out of that safe space, it's uncomfortable.
Mm.
That doesn't mean it's a bad thing. It just means you can't play that game now. You know, because of the events around you, we're going to have to develop a different game.
Yeah.
And some people just, you know, I would say probably 1 out of 10 people have actually taken advantage. You know, the ironic thing is 20 years from now, or let's say 10 years from now, when the COVID crisis has been resolved and maybe we have a vaccine or whatever, it just naturally changes. People will look fondly back.
Yeah.
Remember when we were locked up together for, 60 days? And they'll generate these positive memories. But the problem is they won't have had any of those positive experiences at the moment when it actually happened.
Yeah. That's reality.
It will all be part of a story that, basically we went through something very traumatic together, and, God, yeah, you were whining like a stuck pig half the time, and people will laugh about it. But, the problem is nobody got a huge boost of life. Very few people got a huge boost of life
Yes.
from that opportunity. That's just the way we are.
Yeah. Thank you so much, Doctor. This was a very interesting and informative conversation, and the 3 I's and the 3 steps really helped me understand the process of it and how to help. And I'm sure that this will help a lot of people who are watching this, in different format in YouTube or something which we are putting in. Thank you so much for this. Thank you so much for agreeing to talk with us. Thank you, Doctor.
My pleasure, and the best of luck to you folks out in India.